Hi, my name is Jessica Seipel. I'm with the Howard County Library System. Welcome to our COVID-19 community panel. Please use the Q&A feature to ask questions during the presentation. However, you can also ask them in the chat and I'll be monitoring that. If you have any technical issues, send me a message in the chat and I will try and help you out behind the scenes. But otherwise, this community panel is presented in partnership between the Howard County Library System and the Howard County Health Department. Our panelists will be sharing experiences from the field and addressing concerns and questions about COVID-19. And thank you to all of our panelists and our attendees for joining us. I'd like to introduce our moderator, Dr. Gail Mcdonald. She is a board certified physician and surgeon of obstetrics and gynecology. As a women's health provider for over 20 years, Dr. Mcdonald has been actively involved in the advancement of preventative practices by providing both healthcare and outreach. She completed her undergraduate education at the University of Virginia. Her medical training was completed at Howard University College of Medicine. She is a full-time faculty attending at the Sinai Hospital of Baltimore, and locally she is an executive board member of the African American Community Roundtable of Howard County and serves as the health community chairperson. So I'm going to hand it over to Dr. Mcdonald.
Hey, thank you, Jessica. Greetings and welcome to tonight's County COVID-19 panel discussion. The impetus for tonight's panel stems from the community partner feedback, and all of this is in reference to our COVID-19 vaccine. To bring you up to date on the current data from Maryland Department of Health, Howard County's positivity rate has been at 1.97%. Our 7-day moving average case rate per 100,000 persons is now at 4.43. There are currently no COVID-19 admissions to the intensive and acute care units of Howard County General Hospital, but sadly, we have lost 351 of our county residents to COVID-19. We continue to keep their loved ones in our thoughts and our prayers. Getting vaccinated continues to be the best way to prevent severe illness and death from COVID-19. So we continue to work towards increasing both vaccine and booster uptake among all Howard County residents, pediatric and adult alike. So earlier in the season, a survey went out to our community partners, and much of the feedback we are going to address tonight with our panel of providers. Present with me on the panel are Dr. Temitope Bada, Dr. Jacqueline Duchess, Dr. Dimitri Kopay, and Samantha Cribbs, RN. At this time, I'll ask them to introduce themselves and share how they came to be on tonight's panel. Dr. Duchess.
Hi, good evening, and thank you for the introduction, Dr. McDonald. So I'm Jacqueline Duchess. I'm a board certified pediatrician. I live and work in Frederick County, and I came to be a part of the panel because of my past association with the Howard County Health Department. And I'm looking forward to tonight's conversation.
Hi, I'm Samantha Cribbs. As Dr. McDonald mentioned, I'm a registered nurse. I currently work as the clinical practice and training manager at the Howard County Health Department. My previous career was in pediatric emergency medicine at the University of Maryland Medical Center in Baltimore. And I came to be on this panel because before I came to my current position at the health department, I was the COVID vaccine educator for the nurses and the MRC volunteers that were our vaccinators at our clinics throughout the time. So I'm excited to be here and talk to everyone.
Hi, good evening. I'm Dr. Temitope Bada. I'm board certified OBGYN, currently working with the Howard County Health Department. My background is in academics and private practice, but currently working in public health. I came to be a part of this panel because of my passion in making sure that parental households and women and children alike are well informed about their health and any decisions that they make regarding their family. So I'm really excited to be part of this discussion tonight. Thank you for having me.
I think you're mute. So I'm Dr. Dimitri Coupe. I am a board certified family physician. I am the owner of Coupe Family Medicine, my own family medicine practice. I do take care of patients in Howard County, Prince George's County, and I came to be on this as part of the Onyx Medical Society. I do have a passion for preventive medicine, and vaccination is a very passionate topic for me. And so I was more than willing to be a panelist on this discussion so I can really kind of help clear the misinformation out there and hopefully improve the health of our communities.
Awesome. Well, we're going to jump right into it. We have multiple questions. The format of today, of course, is that we're going to start with our discussion, but we are open to questions. If you can place them in that Q&A box, that would be perfect. And as we finish up the discussions, we're going to go right to question and answer. So we'll leave ample time for that. So I'm going to start with Dr. Duchess. Dr. Duchess, based on community feedback, one main concern relates to vaccine safety. Comments from those surveyed include COVID-19 can alter human DNA. There's a fear of getting COVID from the vaccine itself. The vaccine was developed too fast. Others have voiced concerns that getting the vaccine could lead them to contract other conditions. One example being autism. And there are some who have chronic medical conditions, and they are worried that the vaccine will interact with their medical conditions. Dr. Duchess, how would you address these concerns?
I think that's a very important question. And you know, in practice, I've had parents who have voiced their concerns about the vaccine. And I think first and foremost, as a provider, I think what's really important is one, to acknowledge the concern that our patients and families have, and to really lean in to listen to find out why, you know, what the actual concerns are, so that, you know, we can adequately address the specifics that they may have. And then based on learning more about what the concern is, then really, you know, providing the evidence-based information, right? That expertise that we have to reassure patients about, one, the safety of the vaccine. You know, you talk about concerns about, some people have voiced the concerns about the mRNA vaccine altering DNA, right? So again, it's just really leaning into sharing with people the data that we have, right? And reassuring them that the vaccine is safe, it's saving lives. There are millions of teens, young people, as well as adults across the country, across the world, that have received the vaccine. And, you know, and they because of the vaccination, right, we've really reduced the rates of those who are vaccinated being having severe illness or hospitalizations, and even preventing death. So I think it's really important to really lean into and listen and understand where people's concerns are coming from, and giving them the evidence that the vaccine is safe and effective.
Thank you. I would like to give an opportunity for Samantha. I'm going to give you a little different question that speaks to medical concerns, okay? Because that's another reason that we've seen a lot of the responses here saying that the decision to receive COVID-19 vaccine was not their choice because of certain medical concerns. Some were concerned about the side effects, others concerned that they got COVID-19, so why do they even need a booster? Others have said that the virus mutates too fast and the vaccine is not effective. And there's others that just feel that there may be some long-term risks associated with the vaccine. How do you address in your practice these types of medical concerns?
Thank you. Thank you for that question. Those are all, going off of what Dr. Duchess said, those are all things that I think we've all kind of thought about at some point or another on our vaccine journey, as far as side effects, what's the result of natural immunity if we've gotten COVID, what are the long-term side effects. And again, like Dr. Duchess mentioned, the data really supports, starting with side effects, that these vaccines are incredibly safe and incredibly effective. But as far as safety, these vaccines have been some of the most highly monitored for safety of any vaccines we've ever seen in the history of this country, because they are administered under this emergency use authorization, which we've heard about. Providers are actually required to report any adverse events after vaccination, whether they're related or not to vaccination. And then the studies, now that we've been doing this for over a year, we're starting to see the studies come out that are showing that this side effects continue to be mild to moderate, and that any long-term side effects or severe side effects continue to be very rare. Most side effects, injection site pain, headache, fatigue, those are things that we typically see, and those are not things that are uncommon for vaccines we're more familiar with, like a flu vaccine. And so as far as the other parts of the question, the need for a vaccine or a booster if you've had COVID, we know that you do have a degree of natural immunity if you get COVID, that is for sure. But what we've also seen is that type of immunity wanes a lot quicker than the immunity we get with the vaccine. The thinking around the natural immunity is that it might be as much as maybe 1 dose of an mRNA vaccine, and we know that mRNA vaccines are 2 doses is just the primary dose. And we also have booster doses now. And they've seen that people that have gotten COVID-19 and then have chosen to be vaccinated actually produce a very high immune response. So it just further supports the need to be vaccinated, even if you've had COVID, and then also to get that booster vaccine, even if you did get, like, say, a breakthrough, on our most recent Omicron wave, where we saw, more breakthrough infections than we did before. And then as far as with the virus mutating fast and vaccines being less effective, we know that, yes, the virus mutates fast. We've seen a lot of different variants, and it definitely affects the efficacy of the vaccine. But when we think of effectiveness, we also need to think about not just getting COVID as part of effectiveness, but the effectiveness against the severe effects, the hospitalization, the disease, and the death. And again, not to repeat myself, but the data continues to support that these vaccines are extremely effective in preventing the severe side effects. So, like, for instance, with Omicron, they found that unvaccinated adults were 12% more likely to be hospitalized than vaccinated adults. So again, just continues to be incredibly effective. And then the long-term side effects that we talked about, especially for, I know there have been a lot of concerns now with child vaccination. We heard that a lot as far as long-term risks for children. And again, when we think about those long-term risks, especially at this point in the pandemic, we need to think about long-term risks for children of getting the vaccine or long-term risk for children of getting the virus. And when we think about it in those terms, it's very clear that it's much safer for children to get the vaccine than to run the risk of getting COVID. We've heard about some of these side effects that are affecting the rare side effects that seem to be affecting maybe the younger population, the adolescents, as far as like that myocarditis that we saw more present in young males as far as a rare side effect. But again, the data supports myocarditis is something that you can get from having COVID. And when you look at that, young males that had COVID versus young males that were vaccinated, young males that had COVID were 6 times more likely to develop myocarditis than those that were vaccinated. And the same thing with the MIS-C that we saw in children as a result of COVID, that multi-system inflammatory syndrome, which can certainly have lifelong consequences and effects. There actually was some data, I think, from the American Academy of Pediatrics that showed that 2 doses of the vaccine was preventative of MIS-C in adolescents 12 to 18, almost 91% of the time. So again, just kind of framing it in those terms of not just, if I can avoid getting COVID or avoid getting the vaccine, we're kind of at that point in the pandemic, and we saw with Omicron that if you remain unprotected, your chances of getting the virus are much higher. And if you get the virus, the chances of having long-term effects are much, much higher than if you were to get the vaccine.
100%. Thank you. And thank you for that data as well. Much appreciated. Okay, this next question is for our OB-GYN on the panel, so welcome. And this question is addressing our pregnant, breastfeeding, and or those who are trying to conceive. You know, they have concerns as well. They're concerned about how the COVID vaccine will affect them. There's increasing concerns about getting infertility based on having the vaccine, as well as being worried about whether or not there's going to be some type of breastfeeding or pregnancy issue associated with the vaccine for them and for their baby.
Oh, thank you so much for that question. I think as an OBGYN, I counter very often in the office, a lot of individuals coming in wanting to discuss about how to prepare for pregnancy, right? And so vaccination is one of those things that comes up about what do I do to make myself ready? And definitely what we've seen with pregnant women is that getting a COVID-19 infection definitely has maybe some dire consequences. ICU admissions, you have acute respiratory failure, and this also compromised the health of the infant as well. And you've seen an increase in NICU admissions, an increase in respiratory failure with those infants who had mothers who were exposed to COVID during pregnancy. And so one of the preventative measures that exists is actually having the COVID-19 vaccine. And, you know, I think it's normal to be anxious about your reproductive ability when you're making decisions. And sometimes this is actually your first parenting decision. Like, what do I do? Is it safe? Like, is this going to hinder my ability to reach this goal that I've set for myself and my family? But there have been a lot of studies that have come out, like small and large, that show that there's no decrease in fertility, the ability to conceive after you've gotten the COVID vaccine. And even those, the Society of Reproductive Medicine have even encouraged women who are seeking infertility treatment prior to go ahead and get that vaccination and complete the series prior to even going through infertility workup. And so, you know, like Dr. Duchess was saying, and even Samantha was saying, is that there was no deviation in the development of this vaccine. And there's been so much robust data and surveillance afterwards to be able to confidently ground our information in science to say that there's no evidence that actually suggests that that your fertility as a female or male is impacted by giving the COVID-19 vaccine. And then there's so much more benefit from being vaccinated to prevent some of those illnesses that eventually might even delay your ability to conceive if you're in the hospital. So definitely being able to be vaccinated, there's so much evidence that actually supports the fact that it's safe and effective. And so definitely would encourage you to definitely get vaccinated. In terms of breastfeeding, and actually, as you're getting vaccinated while you're breastfeeding, some of those antibodies can be transferred to the infant and then adds an extra layer of protection for your newborn and preventing any COVID infection. And so I think that there is, especially since this vulnerable population doesn't have the ability to get vaccinated just yet. And so this is a gift that you can give to your child if so desired to make sure that they're protected against COVID-19 infection. And then during pregnancy, there's no indication that suggests there's a better timing to get it. You can get it in the first trimester, second, or third, and complete the series as scheduled and as recommended. You shouldn't also delay trying to conceive if you're interested, just because you got the vaccine. So you don't have to wait like 3 weeks. You don't have to wait like a month, or you can continue to try and conceive even with like the COVID vaccine. So again, like it's safe and it's definitely effective. And it definitely thinks that there should be an opportunity to bring any of your concerns to your provider so you can make those decisions with information that includes your own medical history. Because if you definitely have comorbid conditions such as hypertension and diabetes, that risk increases for any complications if you get the COVID-19 vaccination.
Absolutely. I mean, this is definite confidence for our reproductive age women. So wonderful points you've brought up there. I'm going to give the next question to you, Dr. Coupe. Here's the question. There's been a long history of mistrust of the government in modern medicine. As a medical professional in practice, how would you respond to these concerns? I think you may be muted.
All right. I'm sorry about that. Yeah, so this is definitely something I deal with on a daily basis, with my own patients. And so I think, first of all, number one, we definitely have to acknowledge the past. I think, we don't talk about it much. And I think that's something we need to do in order to kind of help break down the barriers that have been built up with all that's been done in the past and pretty much throughout human history. I mean, unfortunately, humans haven't always treated each other so nicely and have really done some horrific things. And one of the most famous examples is Tuskegee syphilis experiments. But there are many others that even up until recently that have been going on that just been shed light on. Even up to the 1970s, a lot of people don't even know that a lot of young Latino women were sterilized in Puerto Rico, and really that was kind of sanctioned by the government as well. And so I tell people I get it and I understand. I can understand the mistrust. So the way I approach things with my patients particularly is that I acknowledge and I say, yes, yeah, I can understand why you can not trust things. And I think that kind of helps to, like I said, just disarm people, because I do think being a doctor or being a medical profession in government, there's always going to be some level of distrust because of that history. Then I kind of take my time to get to understand why people mistrust certain providers, I guess. And, and I really try to take my time and listen to their concerns. And I think if we really take our time to listen, we can really glean a lot of information and then use that to kind of help people become more trustful. I tell people about my personal experiences with my passion is getting medicine. And I actually say that one of the reasons why I got into medicine was because I wanted to help people, and I would never do any of those things to hurt others. And I think when people realize that you actually genuinely care, they're more willing to listen to your advice. And being a doctor, people come to us for a consult, pretty much, right? When something's wrong, they're going to ask our opinion, and hopefully they can listen to it. But then at the same time, I also understand we have to give people autonomy. People are free to make their own decisions. So we also need to respect that as well. We can't force people to do things they don't want, but I hope that we as a profession can definitely make people make good informed decisions. And I think by doing that, we can hopefully get better rates of vaccinations, because then people can learn more about that without having to think about all the bad things that were done in the past.
Thank you. It's so important as a practitioner to gain that trust. And thank you for that response, because it was very much, one of the keys to maintaining that good relationship between physician and patient. I'm actually going to turn this back to Dr. Bada. You have another question coming your way. Family and friends often influence a person's choice to get vaccinated, whether it's for themselves or for their child. Many families, they live in the same home together, multiple generations, and they influence both their beliefs and their actions. How would you address someone who is torn between a different opinion of their family and friend versus their medical professional?
Thank you so much for that question, because that kind of tug exists even outside of the conversation of vaccines. Whenever someone is treating any illness or has a question about preventative health measures, there definitely sometimes comes in equipped with, things that have been told to them by family and friends. But I just kind of speaks to the idea of community, right? Mm-hmm. How community contributes to decisions that you're making, because you're not solely making the decision for yourself, right? There's community within your household, within your partner, or even like you spoke to, like multi-generational families living under one roof. So there is like this vested buy-in from everyone to contribute. And they also oftentimes provide familial context that you as a provider don't have knowledge to. But one of the things is our role as a provider is just to make sure that we ground our information in science and truth. And so at the end of the day, ultimately, that individual is responsible for making the decisions that make sense for themselves and for their family. All we can really do is, using a shared decision-making model, is to speak to, like, these are the facts. this is how this might impact you, and then trust that the individual can make the decision that makes sense. We do want to, like Dr. Coupe had mentioned, really foster autonomy and patient advocacy. And so our job as advocates for this patient and being part of that community in which they're going to have to ground that decision is to make sure that that information is grounded in science.
Absolutely. Dr. Duchess, many people get their medical information from social media, and that information may not always be based on science. So how do you, or how can people determine their sources of information to trust? How do you counsel your patients?
Well, again, that's another great question. I mean, in thinking about this question ahead of time, it is hard, right, to really know what's true versus fiction. But on the other hand, I mean, I know plenty of providers similar to us that actually use social media as a way to engage with their patients. So it's all bad, right? And I know that's not what you were alluding to. But I think a lot of times we look at, okay, is it good information? Is it bad information? Who's the source? But again, social media can be a great tool, again, if you know who is behind the social media. So I guess that's really the root of it, right? Mm-hmm. So I usually recommend that people use like .gov sites, government sites, the Centers for Disease Control, state and local health departments. Mm-hmm. Also your healthcare provider, sometimes a healthcare provider also uses social media, has information as well. And then also, really finding, I think, key stakeholders in the community, because a lot of times, even for us as providers, even though we give all the information and we tell our families and patients, okay, so these are all the resources, but yet patients still don't trust those sources, right? Unfortunately, right, for the last couple of years, people have had some legitimate reasons to be concerned about information that has come out, right? So again, they have to be really good consumers. And I think us as healthcare providers and as Dr. Bada mentioned, how we define our communities, right? In terms of, again, this wonderful program that the health department is putting on with partners such as the library, and other community providers really sort of creates a network as well. So, everyone's saying the same thing, right? There's a consistency in messaging that I think also will help instill trust. But again, like you said, it's really about being a knowledgeable consumer and having someone you can trust that's telling you, I think, about, what the right sources are. And in those sources, I would say healthcare providers, .gov sites, key stakeholders in the community that are advocating for the health of the community in general.
Excellent. Yeah, I 100% agree with you. There has been much information put out by the CDC that gives us great guidelines on how to move forward. If there's ever any question, a lot of our institutions are giving you links to those locations, so you can go to your institution sites or your private practice provider's site in order to see where they're giving you additional information as well. So beyond the office, Dr. Coupe, this question is for you. Community members and organizations do try to encourage residents to get themselves and their children vaccinated and boosted against COVID-19. What would you do to inform, or what would you do to support these community members and organizations?
Yeah, no, that's a good question. What I find effective is telling stories. And I do think on a personal level, even organizations, if we can find ways to share stories and experiences about COVID-19 and how it affected our lives, I think we could make really good headways on increasing vaccination rates. As I was saying with my own personal patients, I there's definitely a lot of hesitation, and like I said, rightfully so, with what's been happening in the past. But I actually know people who've got really sick and even died. And me personally, I've had family members die from COVID-19, and I just open up. And I think a lot of times if you can just kind of relate to people on a certain level and just show that, what happens if you don't get vaccinated, and you can see what happens, and possibly, someone like you or a loved one can, find themselves in the hospital or, possibly pass away. And that's something I think most people don't want to experience. And so I think if we can, and like as Dr. Duchess was saying, if we can maybe use social media to really expand on those stories, I think that will do a lot to help increase, like I said, vaccination rates. I think a lot of times throwing facts and numbers, it can get lost. Being a medical professional, sometimes I find myself talking all these big fancy medical terms, and it's not going to reach everybody, but people can relate to stories. People can relate to, like I said, certain experiences that, and then sometimes that's good enough to motivate people. And so I think whatever it could be done, and it doesn't need to be through social media, on a social level, it could be just on a roundtable, right? So if you're Thanksgiving coming around, you still got family members that are hesitant and have their own, theories about things. You can just share a story, say, hey, a friend of mine got sick with COVID and this is what happened. I really, don't want this to happen to you. And just expand upon the conversation. And I hope that will be an effective strategy. So.
Well, I agree with you. That's 100% an effective strategy. If any of us as providers, I know we have stories to tell. They don't need to have names, but they have, definite detail. And those details can share, when they're shared, can definitely cause others to open up and share their own fears and anxieties. I want to wrap this up, the question period, with you, Samantha. This question is for you. How can community members get the COVID-19 vaccine, especially if they don't have access to transportation and they're unsure of where they need to go? Can you share?
Yes, and this, unlike my other, could be a really short answer because I have a very good resource through the health department for the community, and that is our HCHD COVID hotline that I think we're probably going to post the number in the chat for everybody. That is an excellent resource for the community. If you are homebound, if you're having trouble accessing the vaccine, you can give the hotline a call. You will get to speak to a real human Monday through Friday from 8:30 to 4:30. And they can see if we have a clinic nearby, if it's, you only can drive a short distance, or if it's, right near you that you can get to easily, or if you are completely homebound or not unable to get to the clinic, we can connect you with our MICH, which is our Mobile Integrated Community Health. And they work through the Department of Fire and Rescue. And they've been doing a lot of work going out into the community to deliver the vaccine. I don't know if anyone has seen like the big van, but that's what they do. And they've been doing it throughout the pandemic. And we will connect you into that. And then if you just also have questions or concerns or something's going on, you're not necessarily going to be talking to a medical professional. So please remember that if you do call the hotline. But if you have more questions logistically, as far as what vaccine is available, at the clinic, if you're looking for a specific one, that would be a great resource to call. And then if you do go online to our COVID-19 page where you can register for a clinic, you can, it will link you to the clinic that you choose, and it will also list the locations, the times, and the available vaccines at the clinics. And that, as far as we are offering all vaccines still, the Johnson & Johnson, the Moderna, and the Pfizer, and the pediatric 5 to 11 Pfizer as well.
Excellent, excellent. Well, we're at that stage where we're ready for our questions. So I'm going to take a moment and ask the question, and I'll let any of you, you can just pipe on in as you hear the question and you have something to share. So this first question is, I have a young toddler who just turned 2 this past month. What are the ongoing risks with the kids not yet old enough for one of the approved vaccines with restrictions and mask mandates waning? N95s don't fit these tiny kids. So how do we keep them safe as others are going unmasked? Anyone want to answer that?
Sorry, can you repeat the question?
Sure. What are the ongoing risks with the kids not yet old enough for one of the approved vaccines with restrictions and mask mandates waning. N95s don't fit these tiny kids. So how do we keep them safe as others are going unmasked?
Well, I can add, I mean, it's pretty well known that children have a lower risk of acquiring COVID and also suffering from severe disease from that. That being said, there's still quite a number of children who do contract COVID and get hospitalized. Honestly, a mask is better than nothing. In practicing the social distancing guidelines, frequent hand washing, usually that should be sufficient enough. I think there's still ongoing research to figure out ways to reduce risk with children. So I do think it's still kind of an area that we're not too sure of yet, but I think over time we'll have more information. But honestly, I think like I said, just wearing a mask should be sufficient enough. Doesn't have to be exactly. Masks aren't 100%. They slightly reduce your risk. I tell my patients, vaccines are like getting like putting on wearing a seatbelt, right? You can still get in a car accident, but wearing a seatbelt prevents you from serious harm if you were to get in one. And so I think when people think about that, it makes sense. So anything that you can do to kind of reduce your risk, vaccination, mask, that should be sufficient enough. But COVID is new to everybody. So, we're still going to gather more data, and over time, we'll kind of learn better ways to kind of help with children until we can figure out better things along the way.
Excellent. Anyone else want to contribute?
Yeah, I
Sure.
just wanted to add, just to jump on what Dr. Coupe said, because everything he said was excellent, but also creating like a herd immunity in your home, and by everyone getting vaccinated is another way in which you can protect that 2-year-old. So anyone who is eligible to get the vaccine definitely reduces the risk of entering COVID into your household. So those who are eligible should definitely try and get vaccinated in order to reduce the risk to those who are not eligible.
Excellent. Excellent. Anyone else?
Yeah, I just wanted to follow up both Dr. Coupe and Dr. Bada's excellent information. Again, we talked about family, the herd immunity with family, also with family and friends, right? Who our social networks are, right? I think it's important to know, their vaccination status, if they're willing to share, right, their vaccination status. And then if they attend childcare, right, their regulations in terms of staff requirement for staff to be vaccinated, and then whatever childcare or places that you go, just making sure that you can mitigate risk, right? You can minimize risk, but risk, there's no zero, there's no risk where there's no risk at all, right? But I think as much as you can, all the preventative measurements that you can take, and that's all we can do, right? Right now for anyone, even if you are vaccinated, you can still get breakthrough infections, right? But you minimize your risk as best as you can, knowing where you're going, who you're associating with. So that also provides a level of, I think I think it does help reassure you a little bit regarding that.
Absolutely. Yeah, those are great points, especially as you travel around. Herd immunity is exceptionally important as we try to move towards getting these kids acclimated to society again, feeling like they're back in the pre-COVID times. Now, this question's reflecting on older kids. So older kids who've received Pfizer vaccine this winter at 11, but are about to turn 12, so right at the cuff, should they be getting another vaccine at the higher dose after their birthday? So an 11-year-old who's about to turn 12, the question is, should they get another vaccine at a higher dose after their birthday?
So this came up a bunch when we first started the 5 to 11-year-olds, because we did have a lot of people that were very eager to get it right away, because if you guys remember, it was right around the holiday time, but some of them had those like fall, like later birthdays, and would have actually been 12 when they got like their second dose or something like that. And so this was a question we got a lot, and what we told parents were that the vaccines were studied, and what the goal was with the 5 to 11-year-old study was to see from the dose that they got an immune response sufficient to what kids in the 12 to 17-year-old age range got as well, and that the studies were comparable. So with that smaller dose for 11-year-olds, they were producing a similar immune response. But again, as Dr. Coupe has said, as we've mentioned throughout, it is up to the parents, it is their choice, and it's kind of just weighing those risks. Again, like I said, we were near the holidays when that was happening, so it was thinking about who we were going to be seeing. Was it worth waiting if we really wanted them to receive the higher dose, or did we want to get them vaccinated and protected as much as possible and maybe kind of give us a little bit more leeway at the holiday time? And so it would be kind of the same thought going forward as far as kind of deciding, is it worth waiting, or would I rather get them vaccinated sooner and protected sooner?
Okay, excellent. Anyone else want to add to that? Pretty comprehensive. Thank you, Samantha. This third question, I have received my vaccinations and my first booster. Do I still need to wear a mask? I thought I was protected from getting sick from COVID. Who wants to respond? Who do I have to respond to that question? Are they protected? Should they wear a mask?
Yeah, so I'll chime in on this.
Okay.
Yeah, so I used an analogy before with the seatbelt. I think a lot of people understood it that way. But yeah, I sympathize with people because there has been a lot of changes in guidance, and initially people were told don't wear a mask, right? And then now wear a mask. Well, now it's just not a regular mask. You have to wear a 95, and just get one shot, you're protected. Oh wait, no, you need another booster. So I can understand why people are confused about that, and so people really don't know now what it means to be protected. When you're vaccinated, I just break it down for people that it's just a way for your body, your immune system to recognize COVID if you were to get infected. So COVID vaccines they don't prevent you from not getting infected. It's just the response that it's going to elicit, right? So if the COVID-19 virus were to get inside you, most likely you're not going to feel anything, or you might have some very mild symptoms. That being said, there's evidence showing that even if you are vaccinated, you can still get COVID and still shed the virus. So there's always a possibility, even though it's low, that you could still spread it to other people. And you can wear a mask and reduce that risk. It's not zero like we were just discussing before, but any little thing to reduce the risk of spread is better than nothing. I think a lot of people don't realize when it comes to numbers, the whole thing about, things going viral, right? It's just, you infect one person, now it's 2, then it's 4, then 8, and the next thing you know, there's thousands of people infected, and that's just one small community. And we live in a nation that's just very interconnected, right? We're flying, we're traveling around the world, so things can spread pretty fast. COVID went from up in China, then all of a sudden pretty much around the world in 2 months, right? And so if just wearing a mask and cut that number in half, then that's a lot of lives we're saving. So I understand that people probably don't want to wear the mask and thinking that, okay, I'm vaccinated, I don't need to. But sometimes it's just better just to be err on the side of caution and just wear it. But I do think over time, as more and more people get vaccinated, we're talking about herd immunity. COVID is going to be considered endemic, meaning there's always going to be some people getting it, and as long as you're protected, you pretty much can go about your life. And yeah, I don't think we're all going to be wearing masks forever, but it's just a short amount of time. And back in 1914 with the Spanish flu, we pretty much went through the same thing. It lasted 4 years. We only had COVID for 2, so we're going to get there.
So that means we're due 2 more, huh?
Hopefully not. But
well, I don't see any other questions in Q&A, but I went over to the chat because we do have a couple questions here as well. So I want to catch these.
I'm sorry, I just wanted to add one more thing. I also
think, yes, go right ahead.
So the question about the mask, because that is confusing, but I also think just like looking at your guidelines for like the hospitals, like there's certain places where you probably will continue to be required to wear a mask. So if you're in the hospital visiting family members, yes, wear a mask. If you're going to any place where there's a high transmission rate, like those big concerts and stuff, you probably want to wear a mask. When you're flying, I think they're still mandating. So just look for local guidance for wherever you're traveling to see what they are asking and requiring, and then follow those rules.
100%.
You still need your mask in your car or in your bag.
Anyone else want to add to that? Okay, so I'm checking in the chat And in the chat, we have a couple of questions that we don't want to pass up on. The first is, do people who have COVID-19 then receive the vaccine or booster have stronger side effects to those doses? And they qualify it with another statement. Some individuals have said that they had such a bad reaction, they wouldn't do a booster. How would you convey to them the risk benefit in those situations? Does anyone want to take that question?
As for side effects, I mean, everybody's a little different. Actually, I was the only one in my family that didn't have any side effect. But fortunately, I'm the one who actually got COVID even after getting vaccinated. But my symptoms were very mild, so I can't complain too much, right? Everybody's a little different how they're going to react to it. There's no evidence showing that you having stronger side effect will mean you're better protected. Like I said, COVID still, it still needs to be researched more. Maybe we might find a relationship in the future. So I think on it, it's just questionable to say that. As for the bad reactions, I usually tell people, most people get a reaction after a COVID, or actually any vaccine is probably going to cause some side effect. But I say that's the good job that's a sign that it's doing a good job. It stimulates an immune response, and usually that's characterized by not kind of feeling tired, fatigued. But some people do experience some severe reactions, and that is concerning. But it's a very small percent of people who do that. So, just like with anything, there's always a risk and benefit. And this is where I was saying, I think as providers, we need to really take our time and explain to people how things work. Too many times I've had people, they didn't want to get a shot because, last time I got the flu shot, I got the flu. They didn't get the flu, but you probably had a bad reaction, but that doesn't mean, it didn't work. But I do feel like, we as providers, I think that's where we're kind of failing. But and so I'm hopefully that maybe in the future moving forward, like I said, we can really take our time to kind of explain to people really, okay, what to expect as soon as you get a vaccine. And hopefully, again, that will alleviate some fears. And then
I think I got a freeze there. Let's see if he comes right back for us. Okay. In the midst of this freeze, does anyone else want to address the response as well? Is there any additional comments?
I could just jump into, and
Sure.
as far as that, thinking again about the natural immunity versus the immunity from the vaccine, and thinking about the risk benefit, again, you have to continue to weigh that, your side effects, the side effects that you're getting, which might be like a couple of days of discomfort, maybe mostly like a day at the most for the majority of people, versus again, getting COVID. And again, the data supports that if you don't get your booster, or if you rely strictly on that natural immunity, that you're much more likely to get the virus. And then you're susceptible to multiple days or potentially longer side effects or issues or disease as far as long COVID and stuff like that. So just as we're talking about risk benefit, just kind of considering that, again, we always have to think about the vaccine versus the disease and less about just the vaccine in and of itself.
Absolutely. Hi, Dr. Coupe. I know you froze for just a moment. I don't know if you want to just finish up.
I'm sorry, I don't even know why I went off. So what was the last thing you heard me say, I guess?
I think it was just in terms of having that community to support the vaccine.
Well, no, yeah, I was just ending off that, we definitely, we healthcare profession probably could do a better job to kind of explain how the vaccine works. And I was hoping that.
Oh, wow. So we must be having Wi-Fi issues. Okay. We'll give it a moment and we'll move to see if there are any other questions as we wait. And there's been some really awesome comments too. there's one comment here that I just want to share with everyone, that it may take a lot of courage for people to ask their provider questions, and being present and taking that time with them to listen and to get to know what they are thinking, like Dr. Coupe said, is so important. And I
Would help to kind of
agree. Okay. We see you once again, Dr. Coupe. Let's try. We'll try real quick. Go right ahead.
Yeah, I apologize for that. I think that I'm having connectivity issues. No, I was just saying, yeah, I think we just need to do a better job as providers to explain how the vaccine works. So that would hopefully alleviate fears, and so I'm hoping that will help.
Excellent. One of our most important tasks is to alleviate anxiety and fear in our patients, to let them understand through facts, through data, and through actual experiences, that we are able to share with them information that is safe and they feel safe in the process of their care. There may be one other question. I'm going to keep scrolling.
I know there's one here that sort of speaks just to what you were talking about. How can you help kids who may be scared of vaccines?
Excellent. Who wants to address this one?
So I would, probably say something similar to what Dr. Coupe was saying. First, I think we need to also talk with the parents to help them provide that, so that to help be our buffer as well in talking to kids, right? Parents, giving parents some resources about how to talk to their kids before the actual appointment. And then also too, like our offices or wherever the children are getting, receiving the vaccine, how welcoming is the staff that's there to greet them. And then, the rapport with the child, right? So really, understanding where they're coming from and that they are afraid, and talking with them, right? And trying to figure out, like, again, learning from them, why are they concerned? And also really, really talking about, they're doing something so important, right? Really talk about the benefits, try to engage with them. And I know there have been a lot of pediatric providers that have, they have like, tricks of the trade with any vaccine, right? Because kids are, some kids are just vaccine, they just don't want any needles, even as adults, right? We don't want needles. So,
very true, very true.
So there might be fun ways to engage with them, having bubbles or having like little pup, so there are ways to sort of engage with kids. But I think really being welcoming, and having the staff also be well trained in dealing with children that have fears, and also working with parents to provide them some resources for how to sort of provide that pep talk for their kids to prepare them before coming into the visit for the vaccination.
Excellent. Okay, I'm scrolling down once again. And cold, allergies, or COVID, how can we determine between them?
I think one of the great things, public health initiatives, is actually being able to have access to at-home COVID tests. Like, I think that helps eliminate that diagnosis right away. Initially, when we didn't have it, there used to be like a spreadsheet that said, like, if you had these symptoms, this was more likely allergies, if this was cold, or this is COVID. I think, but having the access to doing a take-home COVID test definitely reassures you pretty quickly whether or not this is COVID. And the treatment is somewhat to the same, depending if you have any other existing medical issues. Stay hydrated, get plenty of rest, take any medications that with symptoms in terms of cough drops if you're having a cough, and then making sure that you get in touch with your primary care provider, your pediatrician, relatively if there's any concern that you're just not quite sure of, and that's what they're there for. But that would be my response in terms of determining which is which process going on.
That's right. So there's so much access now to these COVID home tests. So it really does help quite a bit. Does anyone else want to add to that? Okay, I'm going to keep moving forward. I think we have a couple more. Let's see. Are the vaccines and boosters going to stay free? Does anyone know the answer?
That I have no
Yeah,
idea.
It's a great question. I don't think it's up to us, though.
Yeah.
I think if it were, we would say yes.
Oh, that's
think
right.
Right now,
Right
it's
now,
still
yes.
free, so get it while you can.
Yeah.
Exactly.
Another thing to do it ASAP.
Yeah, the
So-
vaccines, most insurances are supposed to cover preventive services. So, so I don't think so. As for COVID testing, I don't know how long that's going to last, but
Yeah.
So yeah, take advantage of it now before.
Right.
100%. So here we are. I'm going to just defer to you, Jessica. Did I miss any questions? Did I capture them all?
There's one more question. How do you address parents' concern that masks will affect their kids' social, behavioral, and emotional well-being and development?
Excellent question. Who wants to tackle that one?
So I would say, based on the patients that I've seen, very young children, this is their normal, right? They've been born into this COVID era where all they know is wearing a mask, or, if their family wears a mask, right? And this idea and many of them have acclimated very well to wearing a mask. The mask, I don't think really, the mask doesn't impact the social, behavioral, emotional well-being, right? I think what really impacts that is how we engage with kids. How do we explain to them why they need the masks, right? And the important role that they play. When I think void of that context for them, in an age-appropriate way, I think it makes it harder for them, right? To understand and deal with things. And I'd say if there's any concerns about your child's social, behavioral, emotional well-being or development, any concerns, please let your provider know, right? And there can be more conversation because, you as the parent, if you're noted or the guardian are noticing something different, again, it may not be the mask, it may be something else. And we don't want to miss an opportunity for any additional resources and supports we can provide to the family and the child.
Yeah, and that can trigger us right into a whole other Zoom session of discussion for our
Can I just add one more thing to that, Dr. McDonald, that
Sure.
jump off of what Dr. Duchess said? I think, again, I keep saying that, but this risk benefit with the masking, what we have seen as far as maybe having a negative effect on social and emotional health of children is being out of school. And so if the opportunity is to have children masked and be able to stay in school with their teachers and their peers and get that face-to-face interaction versus not having to wear a mask and potentially contributing to outbreaks and school closures, I think the choice is pretty clear, and that I think the evidence strongly supports it. So.
Amen. Yeah. So we're here at this point. We have completed our Q&A. We are running out of time at this point. We said we're going to go till 7:30. The questions have really brought us through, but they were such great questions. They were very important. I want to make sure that everyone is aware of where they need to go, and also say, Jessica, if you wanted to add the slide that I could talk about them.
I was one too far.
Okay.
So we'll pop back in.
But in the same time, we want to talk about this resource that is available. This is called Care App. It's a Howard County Health Department website. It connects people to community programs and services, including resources for food, health, housing, transportation, education, employment assistance, and more. Care App can be used by community members seeking community programs. Its translation functionality is also built into the online platform, so for those who require, and it's absolutely free. Anybody can use it. Okay, so this is the link. You visit www.findhdrresources.org. You enter your zip code, you choose a category to browse the local programs. So it's here and it's available right in Howard County. And we want to also ask that those of you who have been on the call, if you could take a moment to complete the survey. We have a QR code here, which you could utilize, or you could log in. And this is our link that you can copy and paste onto your browser. We definitely welcome your feedback. We hope that this session has been informative and we hope that you share it with your family members. Also, as we said, as we started, this session is recorded, so it is available for review, and it should be on our page as well. So thank you. We're at the end of our session. Thank you, panel members. You've been excellent. I thank everyone that's part of the Howard County Library System, as well as Howard County Department of Health. This has been an excellent presentation. We're so pleased that you brought it to us today, and we're pleased to be a part of it. Thank you very much.